A major victory for President Trump. The House passed a multi-trillion-dollar spending plan focused on the president's agenda.
That's right. That vote was very close. Only one Republican, Kentucky Congressman Thomas Massie, joined Democrats in voting against the plan. The budget includes $4.5 trillion in tax breaks, $2 trillion in spending cuts, and $100 billion in new spending for border enforcement and the military.
We are joined now live by Representative Jimmy Gomez, who voted no on the budget plan this morning. Jimmy, thank you so much for being here. I know there's a lot of concern about Medicare and what this looks like. Can you talk us through how you opposed the bill and why you did?
Yeah, this is actually Medicaid. So the reason why I opposed it is I think they're trying to defund, defraud, and deceive the American public when it comes to their plans. One, they're defunding programs that families rely on. Medicaid is a perfect example. It's cutting $880 billion over 10 years, and that means it's going to impact almost millions of Californians. We have 425,000 people in my district alone that are on Medicaid, or Medi-Cal in California. So that means that clinics may close down. That means that their services might be drawn back. That means that they might not be able to get the latest medicine, everything from insulin to other to cancer treatments. So this is a big deal, and they're using it to really give tax breaks to the largest corporations in this country and the billionaires. They tried to lie that they're not doing that cut, but the math isn't mathing. It doesn't work out when you go what they're saying that they're going to do doesn't work out.
Yeah, Medicaid, a big issue here. So let's stay on that topic. Some Republicans are arguing that changing it isn't the same as eliminating some of its popular programs. Let's hear what Republican Mark Elford from Missouri had to say about it.
There is waste, abuse, and fraud in Medicaid. In the Medicaid system, we've got to make sure that that's eliminated, and that we also have to make sure that able-bodied adults with no dependent children are not on Medicaid. And right now, the system says that there are. But I'm not going to throw Granny off the cliff and people who really need Medicaid and depend upon that for their health.
You've already kind of touched on this, but tell us your response to that kind of argument.
Well, first, the congressional Republicans in the last couple of years, I don't think they had any hearings on fraud in the Medicaid system. I think that should tell you that all of a sudden it's a problem for them. Second, it's going to be devastating across the board in Republican districts as well as Democratic districts. And what you're seeing is that they're going to undermine and gut the program. Work requirements, they know that when you add work requirements, all of a sudden you eliminate a bunch of folks. That's about $170 billion. Then you basically have to cut Medicaid expansion because of the Affordable Care Act. That's going to be billions of dollars more. They're going to have to shrink. I had a roundtable with healthcare providers and community clinics. They were very blunt. We're going to probably have to cut back on services. We're going to have to cut back on how many nurses and doctors we have. That means it's going to be longer wait times, and people are not going to be able to be seen. So they're cutting. They're lying about it because they know that it's a very unpopular move that they're making, and their constituents are mad.
Well, you know, that's what I'm finding somewhat fascinating here is you have Steve Bannon, who's a media personality, but a huge supporter of the president, you know, even saying you got to be careful. A lot of MAGAs are on Medicaid. I'm telling you, if you don't think so, you're dead wrong. You have that piece of it. You have other Republicans saying that this is, you know, something that we shouldn't be messing with because we're going back home to our congressional districts and people are pushing back on this. So why are we here now? What got us here?
What got us here is that the Republicans and Donald Trump are valuing one thing. They want to give tax cuts to the wealthiest individuals in the country. In order to do that, it needs to kind of balance out. One, they say that when they cut taxes, it's going to raise so much revenue. That's never the case. They never pay for themselves. That's why Massie, a Republican, didn't vote for it. He said these are optimistic projections that they have, and not based on reality. It never happens. And then two, they're going to have to make up the difference in cuts. So they're valuing tax cuts over basic health care and preventive health care for their own constituents. That's what it's about. And honestly, that's what Donald Trump values. That's why he's pushing them. In the end, they're just going to say that's not going to happen, but we know it will happen.
Talk about the future of this bill. What do you see next for it? Is it likely to pass in the Senate? And I've been reading up on this process called reconciliation that they could use to further this bill. Tell us what's going to happen next.
Well, right now, yesterday was a bill to give direction to the committees in the House of Representatives. Those directions says, oh, this committee must save this much money or cut this much money from federal spending. This committee must do this. So it's instructions to the committees. So and then those individual committees are structured and also stacked with Republicans by the majority that will most likely pass whatever they want. So Ways and Means, which I'm on, they're looking to pass tax cuts. That's what they're going to do. And that's what we're going to try to fight against. Then it goes to the full House, and that's where you're going to see, okay, are Republicans going to vote to increase the deficit and the debt at just to give tax cuts to the billionaires while cutting Medicaid? That's where you're going to see that, that's going to be a few weeks from now. And then the Senate, then it goes to the Senate, and the Senate has to pass that version or their own version, and then they have to reconcile the differences. So there's a few weeks to go on this, and maybe even longer. Depends on what happens with the Republicans and if they capitulate to Donald Trump and they just go along with it, or do they support their constituents or not.
Representative Jimmy Gomez, thank you for breaking this down and being with us this morning. As you just said, it'll be a long road. We'll check in again.
Thank you.